Let's look at some of the indications for intervention in rheumatic mitral stenosis patients. The first major differentiator in the treatment algorithm is differentiating between severe mitral stenosis patients and non-severe, as defined by a mitral valve area of less than 1.5 centimeters squared. Next, we'll determine if they're symptomatic or asymptomatic. In symptomatic patients that are a percutaneous mitral balloon commissurotomy candidate, which from here on out I'll call a balloon valvuloplasty for ease of saying, that is a class 1 recommendation for balloon valvuloplasty. If they're not a good candidate, or they've failed prior balloon valvuloplasty, have severe symptoms, if they're a good surgical candidate, that's a class 1 recommendation for mitral valve surgery. If they're a poor surgical candidate, either high or prohibitive surgical risk, it's a class 2B recommendation for balloon valvuloplasty. In the asymptomatic population, we'll look at 2 other factors. If they have a pulmonary artery systolic pressure greater than 50, that's a class 2A recommendation for balloon valvuloplasty. And if they have new onset AFib, that's a class 2B recommendation. And although patients may not report symptoms, these can be complications from mitral stenosis, which are why they are indications for procedures. We'll swing on over to the progressive mitral stenosis category, where the mitral valve area is greater than 1.5 centimeters squared. These patients have to have exertional symptoms and hemodynamically significant mitral stenosis, where a stress test may show a wedge pressure greater than 25 or a mean gradient greater than 15 during exercise. And that would be a class 2B recommendation for a balloon valvuloplasty in those patients that are good candidates for that procedure.